An overview of the personal outcome measures. Lori, a person receiving services, says it perfectly. I liked my personal outcome measures interview. I show my goals. I'm planning my own life. Simply put, the personal outcome measures, also called the POM, is an internationally recognized person-centered discovery tool. It's used by human services organizations to gain life-changing insights about the people they support. Then, agencies can turn that insight into action to transform lives. Through conversational interviews with people receiving services and support providers who know them best, organizations learn about the presence, importance, and achievement of personally defined outcomes and related supports. It covers 21 quality of life indicators organized under 5 factors. Topics include health, safety, self-determination, relationships, rights, respect, community inclusion, employment, and more. The personal outcome measures uses a 3-pronged approach, beginning with 2 distinct interviews. In the first interview, you learn from the person receiving services about their life, what's going well, areas that could be improved, and goals they want to accomplish. In the second interview, their support staff describe their understanding of the person's outcomes, and if services are in place to facilitate those outcomes. Then, the interviewer shares what was learned with the person and their support team to improve services and better match what the person wants for their life. From the process to the questions, the personal outcome measures ensures that we are meeting the needs of the person from their perspective. It's authentic, shares Leslie Long from the ARC of Cape May County. With that, the tool is unique because it focuses on what's most important to the person compared to the services system determining what is important for the person. This principle was part of the tool's inception. CQL began its work on the personal outcome measures in 1990 after realizing that there were big differences in what people and their families wanted for their lives and services compared to what professionals wanted. CQL conducted focus groups on quality measures, bringing in people with intellectual and developmental disabilities, people with psychiatric disabilities, families, and other thought leaders. After extensive piloting and testing, the first POM tool was published in 1993. Since that time, the POM has experienced some updates, revisions, and reorganization, continuing to be a relevant and transformational tool to improve people's lives. Erica Jaimo of Welcome House Inc. says, the information gathered during the POM process will be implemented into the person's plan and integrated in the person's individualized supports. So what's the impact and benefits of the personal outcome measures? At an individual level, people identify what matters most to them, and then share if they're getting the support they want and need to make those dreams a reality. It is used to inform a truly person-centered plan, track progress in implementing that plan, and highlight areas where services should be improved. At a provider level, organizations can assess the impact of their supports, identify the effectiveness of services, and better understand where improvements are needed. POM data is so valuable that organizations even use it in aggregate to develop training initiatives, assess agency-wide programs, draft strategic plans, and more. At a state level, systems can use data for quality assurance monitoring. This can include analyzing trends, evaluating resource allocation, and reporting to governmental entities. In fact, the Personal Outcome Measures is a nationally recognized tool by the United States Centers for Medicare and Medicaid Services, or CMS. It was even included as part of the CMS's Home and Community-Based Services Quality Measure Set. And there are many ways to learn more about the tool and start your journey of person-centered discovery. You can read the Personal Outcome Measures Manual by ordering a printed copy or by downloading a free electronic version on CQL's website. Watch numerous free webinar recordings about the Personal Outcome Measures on CQL's website and YouTube channel. Access various free guides about the POM, including the Outcomes Overview Guide and Consent Form, the POM in Pictures tool, an information gathering worksheet, or our most recent POM benchmarks report. Attend a 1-day virtual introduction to POM training or a 5-day virtual POM workshop. These are essential to learn about the tool, its application, and its benefits, straight from a CQL expert. Pursue CQL certification in the Personal Outcome Measures to ensure reliable implementation of the tool through robust training, a comprehensive inter-rater reliability process, and ongoing professional development. One of CQL's partners, Jennifer Stavenhagen of the Adirondack ARC, states perfectly that by truly listening to people, we're able to provide those supports they want and need. The Personal Outcome Measures help us achieve this with people. It's clear why the Personal Outcome Measures has been an internationally recognized person-centered discovery tool for decades. It focuses on what really matters, learning about people's hopes, dreams, and aspirations to transform services and transform lives. To learn more about the Personal Outcome Measures, visit c-q-l.org.